addition to the slides for the handout, you also should have downloaded a separate document which actually has, I think it was 9 case examples that I wanted to take a look at the end of the program for the duplex coding. So with that said, let's go ahead and jump into today's program. And the first thing that I want to talk about briefly are just the CPT requirements, the general requirements for ultrasound guidance and for diagnostic ultrasound. And one of the first things that you'll see in the CPT manual is that ultrasound guidance for procedures, typically this is going to be for any of those IR procedures like biopsy, paracentesis, things of that nature. So some of you on the call may be coding those, others of you, may not. So we're just going to touch on this briefly. And for ultrasound guidance, permanently recorded images have to be stored in order to report ultrasound guidance. And the CPT manual actually states this. If you go and look at the beginning content in your CPT manual, you'll see that it says that ultrasound guidance requires permanently recorded images of the site to be localized, as well as a documented description of the localization process. But then it also goes on to say either separately or within the report of the procedure for which the guidance is utilized. And the reason why I take the time to read that is because the question comes up, do I have to see documentation of that in the actual report? And if we're looking at the CPT requirements, the expectation is that it's documented somewhere in the medical record. You wouldn't necessarily have to see it in the report. Obviously, it's recommended to put detailed documentation in the report so there isn't any question. But really the key that you want to remember with ultrasound guidance is even if the ultrasound guidance, the storing of the permanent images, the ultrasound guidance should be mentioned in the report, so there's no discrepancy about coding. But even if they're not communicating that there's a permanently stored image, it's important to note that in the event of an audit, a payer may ask you to produce those permanently stored images. And I have heard instances of that happening, so that's very important. And then moving on to diagnostic ultrasound, once again, permanently recorded images are required to be stored, whether that be in hard copy, whether it be in packs. Now with technology, everything is electronically stored. And so that needs to be documented. And also with ultrasound, the expectation is when you report the ultrasound codes that a thorough evaluation of the organs or the anatomic region in question, that is actually evaluated. You have documentation of the image, and then you have a final written report with interpretation. That's required for diagnostic ultrasound. So sometimes what you'll see is that handheld devices may be used for different purposes in conducting ultrasound. And what you need to remember when you see a handheld device being used to perform an exam is that it's not going to qualify for these diagnostic ultrasound codes unless you have a hard copy output that comes from a handheld device. So that's something that you want to keep in mind. If you see that those are being used, you want to make sure if they are, it produces a hard copy output. If not, then the codes would not be applicable in those situations.